Welcome to the Weekly Dose Podcast, your one-stop shop for the weekly news in incretin mimetic therapies, with your host, ManOnMounjaro, Dave Knapp.
Welcome to the news-packed Tuesday, September 24th, 2024 edition of On the Pen, the Weekly Dose Podcast. I'm your host, Dave Knapp, ManOnMounjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, that pen, and that's what we talk about here at On the Pen, and there is a ton to get into, so we're not going to waste any time this week. In huge news in the GLP-1 community world, my group On the Pen, Zepbound for weight loss on Facebook, 20,000 people strong, was suddenly and without any explanation restored. So we've got the community back there over on Facebook. Of course, we did change the name to that to On the Pen with Dave Knapp. And so you'll want to go check that out if you haven't already checked it out. But great community over there. Of course, we started a Discord in the process as well. So you want to check out the On the Pen Discord. Just search On the Pen everywhere and find us wherever you hang out, because chances are wherever you hang out, there is a On the Pen community there. We've got a ton to get into this past week. We received confirmation from Eli Lilly that they were indeed sending at least one letter out to patients who are on compounded versions of tirzepatide. We've only got one confirmed case, but we did receive confirmation from Eli Lilly that this was indeed from Eli Lilly. And we got an official statement from Eli Lilly basically stating that they were contacting a patient who had contacted them previously, and that this was in pursuit of pursuing the safety of medication. So that's the party line from Eli Lilly. Fascinating as that story first broke. It did not appear to me to be authentic for a number of reasons, but ultimately it did end up being authentic. So we will continue to follow that thread if it leads anywhere. Some really interesting news over the last couple of days as Capitol Hill has been gearing up to host the CEO of Novo Nordisk in a help committee hearing that is examining the high cost of GLP-1 medications in the United States compared to the rest of the world. And it was just a fascinating conversation. If you missed it, you can watch the replay of it at On the Pen's YouTube channel. It was a really fascinating. It was about 2 hours and 15 minutes long, and it was just a good back and forth about really the convoluted nature of the healthcare system in the United States, especially as it relates to how much PBMs are taking out of the chunk of the cost of medications that are sold in this country. And the astounding headline to me was that the CEO of Novo Nordisk essentially said that 74 cents of every dollar of their medications sold in the United States are going back to PBMs in the form of rebates or back to insurance companies. 74 cents. So when you think about the list price of Wegovy or Ozempic, 74% of that $1,000 or around $1,300 for Wegovy is going to the PBMs, according to the CEO of Novo Nordisk. That's an astounding number, and it highlights the importance of our movement to see some meaningful PBM reform. So if you're making content about this out there or interacting with content that has to do with PBMs, use the hashtag PBM reform. The other thing that I found interesting was there's a lot of talk about government regulating the cost of these medications on these companies. And I found it interesting because what you did see over the last couple of years happen was there was a lot of pressure put on the pharmaceutical companies that make insulin products because of basically some issues going around the way that insulin is priced in the United States, which ultimately led to Novo Nordisk and Eli Lilly reducing the price of their insulin products. What was also fascinating was that a large part of this conversation took place around the fact that Novo Nordisk isn't making as much of their insulin products as they used to be. And I find it interesting because I'm not sure what we expect when we reduce incentive to make a medication in the United States. certainly we incentivize companies to make more of medications that they make more money off of. And so I found that to be an interesting sort of undertone of the entire discussion that took place. Because if we were just to suddenly demand that drug companies bring a drug to market at a certain price and you take away that incentive, I think there are obviously some unintended consequences. Now, something else interesting that came up through one of the exchanges was one of the senators brought up an interesting point about Henry Ford and how Henry Ford's invention of the Model T and his go-to-market seemed to be a volume approach in so far as they wanted to bring as many vehicles to market for as cheap as possible, so as many people could get on board with the advancement in technology at the time. And of course, you sort of see Novo Nordisk coming to market with an equally game-changing product in semaglutide. And so the senators were kind of tugging back and forth saying, shouldn't you just lower the price, bring this to market and get as many customers on it as possible? And so I thought that was interesting because having listened to many Novo Nordisk earnings calls, I think that truly seems to be the heart of Novo Nordisk. The earnings calls, of course, are calls that are taking place between the company and the people who are putting their money into the company. And so when they say something in an earnings call, it's very different than when they're saying something in front of Congress. Basically, the CEO's job there is to protect the brand and to not say anything stupid and make headlines. I mean, that's ultimately what he's going there to try to accomplish for his company. But in the context of the earnings calls, it's basically telling people who put their money into the company what they can expect the company to do. And we've heard them over and over talk about their desire to bring Ozempic, Wegovy, the semaglutide products, as much of it to market for as cheap as possible. And so I think there really is that goal insofar as we have to understand that businesses do exist to make a profit. And I thought Senator Mitt Romney made some really good points about we tend to live in this fantasy world where we expect pharmaceutical companies to innovate, but then we expect them to bring that to market super cheap. And these two things just cannot coexist. And so there was a lot of interesting conversation in comparing the cost of GLP-1s overseas to the cost of the GLP-1s in the United States. Of course, much of that came back to the PBMs and how much the PBMs inflate costs of medicines. But I think you have to look at the fact that expensive medications in the US predates PBMs. And so why is it that the United States has to sort of foot the bill for the innovation that happens in the medical space? You just don't see the kind of innovation coming out of other countries that you do the United States. That is largely because we fund the research and development that goes into these medications. So how do we level the playing field, I think, is the ultimate discussion. I think that starts with the PBMs. Of course, if we can clean that process up, hopefully we could really take a lot of the convoluted nature out of the prescription drug costs system in the United States so that we could have more understandable conversations around the way that they're priced. It's just so convoluted and broken currently. And so it was to me, it did two things. It highlighted the fact that the PBMs are taking an exorbitant amount of money in this process. And it also just underscored how broken the system is and how many people are left on the margins looking at that list price for these prescription drug medications in the United States that are exorbitantly higher than they are in the rest of the world. Just a fascinating conversation. Interestingly, also, they seem to kind of come back to some of the senators to grilling the CEO of Novo on the fact that apparently the PBMs, three of the largest PBMs, signed off on an agreement that if Novo Nordisk lowered the list price of their medications, that they would expand accessibility to the GLP-1s across the board. Now, I think that this was a bit of a disingenuous proposition to put the CEO on the spot, because baked within this conversation was no talk about whether the PBMs were willing to take a smaller rebate on these GLP-1 medications. So, of course, it was easy enough for them to say, yeah, if Novo Nordisk takes less money, we're good with that. That doesn't necessarily mean that the net price changes. for the patients, or accessibility changes much. It just means the list price changes and less money goes to Novo Nordisk ultimately, but does less money go to the PBMs? And so it's just kind of like, I want to know more about what exactly the PBMs were agreeing to there, because I thought it was a bit disingenuous. I want to know the PBMs are willing to forego their 74% or whatever that percentage ultimately is on these two specific drugs, Ozempic and Wegovy. So just a really fascinating conversation. If you missed it, you don't have to miss out. You can go back and watch that in its entirety on the Pen's YouTube channel. Now, there was some other news this week, some brighter news, some happier news in the world of new medications that have been announced over the last couple of weeks. And we want to talk first about Metsera. But before we get into that, just a reminder that On the Pen, the Weekly Dose podcast, is sponsored by our friends at Ro. Ro is an amazing telemedicine company that has sort of pioneered this idea that people should have a frictionless access to doctors and the medications that can help them achieve the best version of them in life. And so we are so thankful for our partners over at Ro, who have a program called Ro Body. Now, the Ro Body program is a program that connects you to a doctor who can help you discuss what your goals for weight management are. If that's something that you struggled with, they can prescribe GLP-1 medications when medically appropriate. And for those who get on the Ro Body program and connected with those medications, they lose 15 to 20% of their body weight in a year. So the Ro Body program is definitely worth checking out. You can check it out at ro.co/OTP for On the Pen. That's ro.co/OTP. Please go there and check it out and give them some love. Of course, if you are looking at getting on a GLP-1 medication, you should always familiarize yourself with the risks associated with the new medication. No medication should be started or stopped without consulting with your doctor or your physician, but they'll give you access to that there. And of course, at ro.co/OTP, you can find out all the safety information about GLP-1 medications within just a couple of clicks. So thank you to our friends at Ro for sponsoring the podcast. So let's get into Metsera. Now, Metsera is a company that we talked about way back in, I believe it was April of this year. And it was a really fascinating company, just kind of hitting the market with some new novel treatments for obesity. And today we learned about one of those treatments that they have in clinical trials. Now, this one is called MET-097, MET for Metsera -097. And this is a once monthly GLP-1. Now, this is really interesting because there's another once monthly out there we know from Amgen, Maritide, and Maritide's a monoclonal antibody delivery system. That's what allows the half-life to be sort of extended out beyond, just a few days like the current treatments are. I think 3, 5, 7 days for the current treatments. Of course, if you're into liraglutide, which is the oldest and the only generic, that's just a few hours. And so really what they're looking at is expanding the half-life of these medications. So Amgen obviously did that, wrapping their GLP-GIP receptor blocker into a monoclonal antibody treatment called Maritide. But this one here from Metsera, there's a lot of names we're throwing around. Like, how are you ever going to keep any of these straight? But Metsera's MET-097 is actually a GLP-1 receptor agonist, so just straight GLP-1. And it utilizes a patented technology that Metsera owns called Halo technology. And this Halo technology is sort of fascinating because it's a specialized patented lipidization process. So they find a way to basically wrap the GLP-1 receptor agonist in a fat molecule that extends the half-life up to, get this, 380 hours. That's like 15 plus days. That's about 3 times the length of time of a half-life of the current treatments. So that is a really interesting deal. And what we found with this early clinical trial is that people lost 7.5% of their body weight in just 36 days. That's tremendous. And not only that, but the weight loss continued for an additional 4 weeks, presumably because of the longer half-life of the medication. So Metsera is going to be a very interesting one to watch. Of course, we're years in it. The questions that always pop up in the comments of when is this going to hit the market? We are ways out for these folks, right? We are, but the future is bright and time just flies, especially if you have kids like me. It feels like once you start having kids, life steps on the accelerator. This stuff will be here in no time. And in the meantime, hopefully we can get by with the treatments that are out there. But that's Metsera's Met097. You heard it here first. That's going to be a once monthly GLP-1 utilizing halo technology, a lipidization process, so not a non-monoclonal antibody. That'll be very interesting to watch. Another one that we heard of, and this one is actually the one that I got really, really excited about because I don't care. I'll take it once daily. I'll take it once monthly. I just want it to work. The frequency for me is not that big of a deal. Now, what is that big of a deal is the potential of the medication to not only encourage weight loss, but encourage the good kind of weight loss that preserves muscle mass. This is amazing. Biomed Industries announced their quadruple agonist. You heard me right, 4. Quadruple agonist. So you've obviously followed me long enough to know about retatrutide, which is a triple agonist, glucagon, GLP-1 and GIP. Predominantly a GIP medication with the GLP-1 and glucagon kicker. Of course, we've belabored what retatrutide can do, but this is a once daily capsule, a pill, a quadruple agonist pill called NA931, which is an absolute, look it up, look up Biomed Industries. They're going to be one to watch here because this is one of the more fascinating clinical trial level drugs that we have talked about here. So it regulates the homeostasis. So just to back it up, like the triple G and retatrutide, glucagon, GLP, and GIP, it adds insulin-like growth factor 1, IGF-1, to those 3 to get your quadruple agonist. It easily crosses the blood-brain barrier, so just a small dose of the medication is required for efficacy. And the drug in early-stage clinical trials has shown the following properties. Get this. It exhibits neuroprotection. It regulates the 4 hormones, IGF-1, GLP-1, GIP, and glucagon. It has great bioavailability. It's very safe with no toxicity observed in the trial. It's been shown to significantly reduce body mass index without causing muscle loss. That's the kicker, without causing muscle loss. And it's available in an oral formulation, a once daily capsule. Now, in this phase 2B trial, people saw up to 26% loss in body weight in just a very short, I don't have the exact date amount of time here, but 26% body weight in just a short amount of time. So this is a really exciting candidate to watch from Biomed Industries, NA931. Check that one out. That's going to be a fascinating one to follow. Thanks for hanging out with me for the news this week. There was a ton to talk about, and of course, we've been wrapped up with the Novo Nordisk hearings and all of that. So thanks for bearing with me through a little bit of I feel like this is a bit of a stuttering and stammering through a podcast. There's just a lot on my mind with everything that's going on, but wanted to share this news with you. If you enjoy the podcast, if you enjoy the Weekly Dose podcast, please give it a 5-star rating and review. That super, super helps out what we're trying to do here at OnThePen. Thank you for all your support and your encouragement along the way. Until next week, I hope that you all have a great week. Please join us on Thursday night on YouTube for our Thursday night live show. OnThePen Live happens every Thursday, 9 p.m. Amy in Half, which Amy is an amazing content creator in the GLP-1 space. She's seen tremendous progress with weight loss, and she is the best at making those clap back videos when people say stupid and unintelligent things about obesity and obesity management. She's great. Can't wait to have this conversation with her. That's going to be Thursday night. That's why you got to go over to YouTube and you got to give us a follow because we're doing exciting things. If this stuff gets you excited, if GLP-1 medications get you excited, then you are missing out if you are not following our Thursday night live show. Until next week, thanks for hanging out with me. Appreciate y'all. Have a great week.